Hello everyone, I'm JR, your host today of the Criminology Chats podcast by the Chicago School. Today we have the privilege of having on our show Denise C. Vargas. Dr. Vargas is a licensed clinical psychologist. She received a Bachelor of Arts degree in psychology from the University of Colorado at Denver. In 1999, she headed to the San Francisco Bay Area where she earned her master's and doctorate in clinical psychology at Argosy University, completing that in 2006. She has a lot of different clinical experiences ranging from working with the developmentally disabled foster children to adults in crisis coming out of the hospital. In 2009, she began working with the correctional population in Denver through the Denver Sheriff's Department. She ran Mental Health Treatment Pod 1, of the first of this kind in the jail setting, providing services to critically underserved and marginalized population. She also employee assistance to firefighters of the Adams County Fire Department, include training the firefighters on impact of vicarious trauma and how to improve their general mental well-being. She also trained in 2015 in the eye movement desensitization and reprocessing EMDR, which is a highly effective therapy that is designed for working with distressing or traumatic memories. We welcome her today, and she is going to give a presentation on what it's like to work inside a jail system and the process of helping inmates in that setting with their mental health. Today, she'll be speaking to several students in the Chicago School of Criminology and Forensic Psychology. There are several students attending, so there'll be questions from those students during this podcast. So welcome today, Dr. Vargas.
When I applied to the jail, they were in the beginning of setting up two specialized pods, one for the men and one for the women. They had already set up the pod for the men, and that particular pod was to reduce recidivism of people coming back into an incarcerated situation who had what we categorize as an Axis 1 mental illness back then. They've kind of done away with the Axis 1 diagnosis, categorizing of diagnoses. So we don't call it that anymore, but really it's people who have psychosis, people who have bipolar disorder, thought disorder, schizophrenia, schizoaffective disorder, some of the more severe spectrums of mental illness. And what they decided is that folks were coming back at something like a 99% rate. They were coming back into an incarcerated situation. And what we do know today is that jails and prisons actually house more mentally ill people than our actual hospitals do. And there's a whole lot of reasons for that I'm not going to get into, mostly political, mostly money. But it is less expensive to incarcerate people than it is to put them into the hospital. It costs anywhere from about $40,000 to $60,000 a year to incarcerate somebody with mental illness versus the $400,000 it would cost them to be incarcerated or to be kept in a hospital setting to treat their mental illness. So what I thought, I didn't know where anybody was at. So if this is like completely off the mark, please stop me. But what I thought I would review is kind of what is the difference between forensic and correctional psychology? Because I think a lot of times you hear them being mixed. And they're really not the same thing. So I was going to review that. Understanding criminal behavior. I think that there's a lot of pathways to why somebody engages in criminal behaviors. And so kind of just reviewing that, seeing what people's thoughts are on that. What interventions and expectations of treatment are in a correctional setting. Because obviously, because they are incarcerated individuals, resources are going to be less accessible. And so we kind of have to try to make miracles happen at times in corrections to be able to provide the best kind of care we can with the littlest amount of resources available to us. But they still have to be evidence-based, they still have to work, all that stuff. So review some of that. And then if we have time, we'll kind of review what psychopaths and sociopaths are and maybe kind of clarify that. I don't think we would have time for a case study, but I would encourage all of you to, on your free time, look up Ed Kemper. I don't know if any of you have watched Mindhunter, I think that's what it's called. That actor portrayed Ed Kemper pretty on mark. I can believe he probably needed therapy after he was done with that role to undo the role that he was playing within his own mind. But it's an interesting case study, and I think that it enlightens folks to just the chaos of the mind and what's going on there. And I think it's a good case study to understand that kind of behavior. Okay, cool. Let's jump to the next one. Awesome. So what's the difference? Okay, what's the difference? So forensics. So when we're talking forensics, we're talking legal matters, how it's applied to the law. Can somebody engage in their own defense? It's very legally driven. And essentially, courts make decisions around forensic evaluations. A forensic evaluator is a psychologist who specializes in assessment, evaluation, and it's purely driven for legal reasons, because then this psychologist is going to testify to court whether or not they feel this person is legally competent to continue working in their own defense, or if they need to be restored. And so that's what a forensic psychologist does. And so they're going to gather information. They're going to get access to documents from this person's entire history. And a forensic psychologist is also going to be the kind of person who maybe down the line might argue NGRI or something like that. And so it's purely evaluational, and it's purely for the courts. A correctional psychologist is somebody who's using our applied knowledge of interventions that work and using them within the correctional setting in order to improve stabilization, reduce offender risk, to be able to allow the care and custody to happen more safely. So we will often work hand in hand with officers to make that happen. And we do use a lot of information from officers, as far as, because I'm one person to 500 officers. So I do rely on officers' input about how somebody is presenting. Are they presenting differently with me versus with officers? Is it a badge thing? Is it a manipulation thing? Is it genuine? Are they presenting similarly across anybody who's interacting with them? And so we do assessment, we do a lot of treatment, and we also train people who are working in corrections, whether they're civilians or officers. So we're going to be doing that stuff. So that's kind of the difference. Will forensic psychologists call me? Absolutely, they do. They call me because I am meeting with the person that they're evaluating on a daily basis. And so they are curious about this person's presentation. If it's consistent, are they seeing it the same way? So we do often work hand in hand with forensic psychologists, but we have different scopes of practice. So maybe in the chat, can people kind of throw in the chat what they think criminal behavior actually is? How would you define it if you had to put a definition to it? No cheating, no Googling it. Just throw it up, like think from the top of your head. Not everybody at once. Breaking the law.
I almost want to say, am I allowed to speak, or do I got a message?
Yeah, go ahead, Sam. Tell me.
Okay, I'm probably way off, but I'll throw it out there. I almost want to say it's kind of like an influential mentality. So when you grow up for, like, not trying to stigmatize, but when you grow up in a poor area or a very criminalized background area, you learn those behaviors and you're raised around, you're exposed around those kind of things. And it's a mindset that you grew into. So now you monkey do behavior.
Okay.
And I would assume that criminal behavior is taking those actions and making it into your lifestyle kind of thing. It's your behavior.
Okay. So maybe it's a host of behaviors that we can characterize as learned, adaptive, something like that. Okay. Great answers. Behavior that leads to poor decisions and criminal acts. Someone that plots. Ooh, that's an interesting one. Committing a crime, breaking the law, illegal activity, abnormal from societal norms, and opportunistic. Could we advance it, please? Next slide. So according to the Encyclopedia of Mental Health, a criminal behavior occurs when individuals are not properly socialized and thus do not feel bound by the laws, rules, and mores that have been established by society, right? So what may not have been a criminal act 50 years ago might be one now. For example, jaywalking. So before cars were a thing, there was no such thing as jaywalking. Jaywalking wasn't a criminal behavior. But then you get cars on the road. Cars are big money makers. Now we're talking money, we're talking politics. And all of a sudden, cars are hitting people crossing the road. Well, they don't want people to stop driving cars and stop buying cars. So in order to reduce the chances of people being injured in this way, they make the behavior illegal, right? And so I'm not trying to like dissuade people from like, oh, now you can drive drunk and some of these other, no, I'm not saying that. I'm just saying that when we're thinking criminal behavior, it's constantly adjusting and changing, right? Because what might seem like a criminal act at one time can change into something that is no longer a criminal act. And what might seem as something as surviving, can adjust as well. And so when we start to too much put people into boxes, we have to be careful with that, because then we forget to ask the why part. And maybe we don't care about the why. All we care about is that they did it. But in my world, I care about the why. Why is this person doing this behavior? What is that about? Help me understand that more, okay? But ultimately, yes, it's something that has, through society, we have shaped these. I mean, I can't even imagine how many laws and rules and things like that exist, which create the norms by which we're all supposed to live by, right? And so we could all be like breaking a rule here and there and never even know it. So next, real quick, there's a good question I forgot to ask. Any idea the percentage of people who will have committed a criminal behavior by the time they are 30? What's the percentage of human beings, do you think? Say what?
I'll say 10.
49%.
I'm going to give a rough estimate and say 70% area.
70%.
Are we talking about like to the minimum, like stealing from like Walmart to like felony level, like all of them?
Absolutely.
Yeah, I would say 70% in that area.
All right. So the answer is 100%. So everybody in this meeting has broken a law at least one time in their lifetime. You probably didn't, maybe you didn't know it, and you certainly maybe didn't get arrested for it, but 100% of people will break a law in their lifetime by the time they're 30. So just keep that in perspective there. So this little chart here is just I just kind of threw it up there because I've been at the jail for so long. I've seen so many different charges. I mean, believe me, there's a lot of different kinds of charges. And what can happen, what happens often if you get into trouble with the police is that they're going to really identify anything within that realm that they could possibly charge you with, because they want to make an honest arrest and they want you to be held accountable for something, right? And so you're going to find that a lot of people's charges might get dropped over time in order for something to stick, which I think can be a little challenging in our correctional environment. So these are just a kind of a quick and dirty list that I put up that of all the different things that you possibly can get arrested for. So if you've ever urinated after the bar out in the back alley, you are breaking a law right there. Some of those things that we may not think about, like if you are hanging out too long outside of an establishment that you don't own or you don't belong there, right? And I think sometimes we think of, we kind of say, well, that's not a criminal behavior, but it must be if it can get you incarcerated, right? So just keeping that in mind. Obviously, there's some other things here that are much more intense and much more severe and much more awful. And at the same time, statistically speaking, people only murder one time, and they will be sentenced to potentially the rest of their life for that, versus something like sexual assault. We know statistically speaking, people reoffend in that way often because sex is our most powerful reinforcer as human beings. It's very difficult behavior to adjust and to switch off. So, okay, go ahead and advance the slide, please. So it's just kind of to my point about criminal behavior some more. So would you steal food to feed your starving family?
Yes.
Absolutely. I would get on the pole and shake my rear end if I needed to feed my family, right? There's no doubt about it. And so I think when we start to put that in perspective, that helps us understand criminal behavior more. Because oftentimes what it is that the criminal behavior is being conducted out of need. Now, that's not going to necessarily apply to our sociopaths and our psychopaths, right? Those are the kinds of people that, they don't rob the bank. They convince their girlfriend who works at the bank to start to embezzle money because that's what's really fun. That's how the sociopath thinks. Versus the single mom who's working at a teller making minimum wage at the bank, doesn't have money for the next couple of weeks, looks in her till, sees, oh, look at all this money. They're not going to miss $40 out of here, right? So starts to kind of reshape how we're looking at criminal behavior. Now, does that make it okay? Who's to say? I mean, obviously our laws say it's not okay. At the same time, we can all argue that, well, if we were really in need, we might do some shady things to get our needs met. There's every officer that I work with says that they've all been in one bad decision away from being an inmate themselves. And so I think that the officers that have the ability to recognize that and say that manage our inmate population the best. Next. And so, when we kind of really start to conceptualize people who wind up in corrections, we start to tease apart all the different pieces of that person. And then at the end of that, we say, well, no wonder why they ended up in jail. Of course, it was kind of like it was written like that was the only place left for them to go. And so keeping that in mind, we try to especially at the Denver County Jail, I think we do a really good job of trying to address those underlying reasons why somebody's winding up in jail, winding up engaging in criminal activity, navigating towards gangs, mental illness, substance use. So
I just have a question.
Sure.
Being that you have firsthand experience, have you worked with somebody who's been able to go to the college program while in prison or jail?
Which kind of program? What was that?
I know in some facilities they offer free college.
Okay, so yeah, so in DOC they're going to do college, right? So they're going to do education. We have a GED program at the Denver County Jail. I would believe that a lot of county jails would offer a GED. It takes a lot of different navigating to get college prep or college courses into a facility. We did attempt it, but at the end of the day, the brass didn't go for it. They felt like it wasn't something that as a facility we could manage at that time. Now, we do know that educating people reduces the chances of them coming back to jail by 29%. So it's definitely something we want to do, but our particular facility does not, aside from GED.
I was going to ask, do you see, because the purpose of it, from what I've been told, is to kind of give them something to strive for. And so when they get out, they have stability, they have something they've earned for. Do you see the success rate in that? Like when they get their GED, do you see that most people when they get it are more successful or have more incentive to do good?
So in terms of where I follow them, my following of them kind of ends when they leave the Denver County Jail. Some will call me and tell me about their success, which I love, or I happen to bump into them out in the community. Now I can't say hi to them first; they gotta say hi to me, but then they'll share their successes, which is awesome. And some do call to tell me that they're struggling. That's fine too. But I don't get to track them in that way. I imagine GED does to some extent, to see. Now I can tell you when they get that GED, they are beaming. They are super excited. They're super proud. I share that pride with them. Even the ones who are going to be going to DOC potentially for a lifetime, they're still proud. It's still an accomplishment. So I want to validate that and support that when that happens. Okay. Oops, I gave you guys that answer already. We can skip that one. Anybody who doesn't think it's 100%, you're all like looking at your own lifetime. You're like, no, it's 100%. So again, and I don't want to focus too much on this, but forensic, it's going to be competency, sentencing recommendations, evaluation of the risks of reoffending. You're going to testify, so you get to go to court a lot. You do get to pay for your expert testimony. You get paid for your expert testimony. You might do child custody evaluations. Those are the most dangerous types of evaluations to do. It is a very high risk as far as the psychologist goes to do those, because for obvious reasons, people tend not to respond very well if they're going to be on the downside of custody with their children. Academic research on criminality and the law. and you're going to be consulting with law enforcement. So that's the forensic. And so you're not really building rapport. That's not the name of the game here. You're going to be evaluating this person. It's not a therapeutic relationship. Privilege is held by the courts, and confidentiality is held by the evaluee. So essentially, when somebody is being forensically evaluated, their rights are suspended. I know that can kind of be hard to understand, but the courts have determined that they are not competent to proceed. And so what happens is a suspension of their rights. And that can be very difficult for somebody to understand, especially when you are the identified person in that, which is part of the problem. So what happens also is their court case suspends. So their attorney is put on hold. Everything about their case is put on hold until this evaluation happens. And if the evaluation determines that they're incompetent to proceed, now restoration has to happen. So a lot of times my folks will think that they are getting out because they're going to be putting them into outpatient restoration. So for some reason they think that their case is done. That's not the case. Their court is just actually waiting for them to be restored to competency, so then they can understand the proceedings of that court case. It can be tricky. In correctional psychology, we're going to be gathering a lot of the biopsychosocial information on a person. We're also assessing their risk. I'm sure it's no surprise to any of you guys that people who come into jail are very high risk for self-harm and harm to others. Those are the two biggies. So we definitely got to be evaluating those almost on a continuous basis. Oddly enough, even if somebody's facing very serious charges, like I have a gal right now in custody, she's being held on a $2 million bond for murder. It's the not knowing part that's the hardest. So when people don't know what's going to happen with their case, that's when they're at biggest risk to themselves. When they find out, so when they have their day in court and they're told, they're getting 48 years, there's a sense of relief. So oddly enough, that's, even though we kind of circle the wagons just to make sure that we are reducing any kind of self-harm or risk to others, they usually experience it as a sense of relief, because now they know. There's nothing more tormentful, I think, to our psyche to not know. When you don't know what's going to happen, you can your brain will take you down every awful pathway that exists. And so when they finally know, it gives them a sense of relief, and then they can plan for that, even if it means they're going to be going away for the rest of their life. We're going to be doing a lot of behavioral interventions. We are going to be working with correctional staff and collaborating with them on next steps. We're always trying to reduce the restrictive housing piece. So a lot of our folks, when they're super psychotic coming into our system, they're smearing feces on themselves. I mean, we've had people pull their eyeballs right out of their head. We've had some really, horrible things that happen. And so those people are going to be in the most restrictive holding pattern as possible until we can stabilize them. But the more increased in stabilization somebody gets, we want them to have more, less isolation and that sort of thing. But initially, I think I kind of try to tell people it works a lot like medicine, that it can look awful on the surface, but what you're really trying to do is help this person from hurting themselves. You don't want people pulling out their eyeballs in a psychotic, dissociative space. And so you're trying to prevent all of that. And it can look not too great, but we're going to be developing treatment. We also help with classification. Although in our particular jail, the sheriffs make the moves of where somebody's going to be housed. They might try to pressure me sometimes, but I got to hold my stance around some things. But ultimately, it is their call if they want somebody to be held in a more secluded way. That's their call. But we definitely have a lot of conversations around classification. Does anybody not know what classification is in a correctional setting? It's just how you house people, how you designate people, and what housing unit they're going to go into. We do a lot of training, and our real goal is to reduce recidivism, particularly for those mentally ill offenders who are coming in behind their mental illness. So a lot of those are going to be like assaults. See a lot of mentally ill people assaulting people. So
before you move on, I just want to point out that there was one question posted in the chat. I think you kind of just answered it pretty well, but the question was, what is the goal of the Denver County Jail? And is it to rehabilitate inmates or?
So that is a good question. So I would say that the overall goal of the Denver County Jail is shifted away from just containment temporary containment until whatever next steps are going to be, towards intervention of certain populations that we're housing in our facility. So we're trying to identify those people who are going to have mental illness and substance abuse. Those are the biggest contributing factors to why they're coming into jail, and we're going to try to treat that, and we're going to try to create wraparound services, because most of these people are going to be back out on the streets. They're going to be part of the community. They're going to be out there living next to us and working in the restaurant we like to go to and all that. They're going to be members of society. And so we do want to try to rehabilitate on some level, because otherwise we're probably putting people just out back into the streets worse than when they can, worse, and creating more challenges and hurting other people and stuff like that. So it's like a mixture. I would say about 30% of the people we are trying to rehabilitate, or at least stabilize and get them in a more positive direction. The others are perhaps less interested in that. We always offer it to them. We do a lot of voluntary treatment. So like if people want therapy, they can get therapy, but it's ultimately up to them. But yeah, I think Denver County Jail is unique in that it has taken more of a stance of trying to provide some sort of intervention at that county level, the city level, versus waiting for DOC to come in and do it.
Hey, Denise, I have a question too.
Yeah.
Maybe you could explain just a little bit that you're a county institution. So you hold, I guess there is a certain limit to what sentences are going to be there to serve out their sentences in the county jail versus going to a state penitentiary or prison. So could you explain, like, for example, if you got a DUI and you got 6 months in jail, you're probably spending it at Denver County. Whereas if you got a murder charge and you got sentenced to over a year, say, 25 to life, then you're going to go to some state prisons facility. Is that correct? I mean, you might want to explain that. Not everyone probably knows the difference.
Sure. So actually the laws have changed in our state. So now judges can actually sentence people to county time for as long as they would like, which created a couple of challenging situations for us, because we've got one guy got sentenced to jail for 9 years, and then he was going to go to DOC for 16 because he pissed off the judge. Excuse my language. I hope I don't offend anybody with some of how I say things. So that did change for us. Originally, when I first started at the jail, you couldn't be sentenced to the county jail for longer than 3 years. That was the limit. If you were going to be sentenced for any kind of crime longer than 3 years, you were automatically going to be kicked to DOC. But about 4 years, like that would have been about, I think, 2012, 2013, they passed a new law allowing judges to give as much county time as they would like. That's a challenge because county jails are built to be temporary holding facilities, not permanent holding facilities like DOCs. And so county jails and city jails are for the city, right? So we, because Denver County is a very big, large county, we have 2 county jails. And so we have one downtown and we have one out of county, and we kind of split the inmates. On average, we probably have about 3,000 inmates on any given day. About 1,000 of them are going to be out of county because it's our older facility, and about 2,000 are going to be downtown because it's our brand new shiny one, and they like to show that it's working. And then once a judge sentences you, if you get charged on a larger crime that's going to be DOC worthy, for example, murder, rape, assaults that are serious, things of that nature, or if you engage in repetitive criminal behavior, so say that you are a DUI offender that keeps recidivating and you keep driving drunk, and now it's like your 5th DUI, you're probably going to go to DOC. You're going to do DOC time now. And so I think judges so far have been pretty, we had to, as a city and county jail, we had to go to the mayor and some of our representatives and say, hey, judges need to be informed that we are a short-term facility. So they've really backed off of those kinds of sentencing practices, thank goodness, because what happens if somebody gets sentenced to the county jail for 9 years is we then have to collaborate with different county jails to rotate that inmate so they don't learn our system. If you've ever been inside of a jail or even a prison, they're designed specifically to confuse somebody if they get out. So that way officers have time to get to them before they escape jail or escape custody. So if we have somebody who's in there long enough, they're going to figure out the system. They're going to figure out the weaknesses of the system and exploit them. So I know that that's maybe, I don't know if I answered your question or not here.
Absolutely.
We can go ahead and jump past this one. I don't need to. So then, you know, if we're thinking correctional, we're starting to look at this individual a little differently and saying, which of these areas can I focus on helping this person with so that maybe they don't come back to jail? Maybe they find healthy peer group influences. Maybe they need help they need an outside case manager because they can't make it to court on time because they're disorganized. A lot of our folks didn't necessarily grow up with healthy, structured family that was loving and disciplinary with them. They were feeding themselves at the age of 5. I have, you know, one patient who was already prostituting herself at 9 in order to put food on the table for her siblings, you know, and she's making cold mac and cheese because she has no idea actually how to cook, but her mom is nowhere to be found, and they just leaving her in the house with her siblings, like she's supposed to be caretaking these kids. And sometimes these stories are really challenging because I'm like, how does that happen? Like, how do people not know that that's going on for some of our folks? And the reality is sometimes people just don't want to know, you know, like we look the other way. We, you know, maybe we were taught to mind our own business, not get into other people's business. And, you know, so some bad things have happened to our folks. And so trying to repair some of that psychological damage that's happened with that person becomes my job. And ideally so that then they stop acting on that trauma and they can live a healthy, functioning life, if even from DOC, even if it means they're going to DOC for the rest of their life. Because you can still function and have some meaningful life in DOC. So this is just kind of a breakdown of what you see in within county jails and prisons and things like that. So SPMI stands for serious and persistent mentally ill. So that's going to be people with thought disorders, delusional disorders, schizophrenia, bipolar disorder. So really extreme highs and lows. And then they become psychotic, typically winding up in the hospital. Lots of trauma. I would argue that that's actually a misrepresented value, but we did a study many years ago, and that was the percentage that came back from the study. But I think that it's often underreported, and sometimes people don't realize something is trauma. They don't categorize it that way, perhaps because it's just been what they grew up in, and it just was the way, so it doesn't occur to them that it's trauma. Traumatic brain injury, which I think was our biggest surprise. We had Dr. Joanne come in from CU. She's a sociologist, was a sociologist professor, and she got a big grant to do traumatic brain injury studies in incarcerated populations, and discovered that, and they did it in 4 different prisons and county jails across the United States. 96% of people had a traumatic brain injury. And a lot of times people don't even realize that, you know, if you get into a fight with somebody, you get knocked out and you wake up on the ground, that's a traumatic brain injury. That you passed out from getting punched in the head is a TBI. You know, your brain hit your skull and you shocked the brain, and it got a short for a bit. So really teasing out traumatic brain injury and working with folks around their TBIs so that they can adapt behaviors to function past a TBI is a lot of what we do. A lot of people are homeless. That's, I'm sure, no surprise, especially if they're fighting a case. You know, in the meantime, say if they even have a place, if they're stuck in an incarcerated situation, you know, you don't pay your rent. Eventually, somebody moves you get evicted. You get evicted on an eviction on your record. Other places don't rent to you. So we've got a big problem with homelessness. And a lot of times our folks don't want to not be homeless at this point. Like, that's their community and that's their family. You know, that's who helps them out. That's who, like, somehow scrimps enough pennies together to put it on their books when they're in jail. So, but a lot of them report homelessness. Substance abuse, I argue again, is that from my perspective, I don't see it. I see it as being such a huge contributing factor to why people come to jail a lot of times. And then I would argue that there's probably addictive behaviors as well, like gambling, dealing drugs. There's a lot of power that comes with the dealing of a drug. And I would argue that those are addictive behaviors. So maybe if we were to include that percentage would be higher. And then just in general mental illness, so depression, anxiety, things of that nature. So this is a guy, I don't know if this video will pull up, but I think it's an interesting video because it shows what somebody who's mentally ill in jail looks like versus somebody who is pretending or faking or just saying that they're struggling with voices versus somebody who really is struggling with internal stimuli. That's what we call it, internal stimuli. So if this plays.
Do you feel anxious a lot? Do you have a lot of anxiety?
I try to stay in my cell as much as possible.
How much of prison and jail is violence and having to sort of be on guard?
All the time.
All the time?
Yeah, I think that's just life is dangerous, so that's just how you gotta just to expect.
When you go from facility to facility, does your medical record follow you? So do they know?
Yeah, they know exactly what to give you, precisely what to give you.
They do, okay. So when you got here, they knew what to give you.
The first day I was here, they gave me my medication. That was good. If I don't get it, then I can't sleep.
I see, okay. And what about Rikers Island? Did you get it at Rikers Island?
Yeah, but sometimes they play a lot of games on Rikers Island.
Like what kind of game?
How can I explain it? Well, they're mean down there. I can't explain it.
New York City is such a loud, crazy place. I mean, it can be.
Yeah.
Is that a hard place for you to be?
So many things can set you off. It is a hard place to be. The traffic lights, the cars, the buses.
Do you ride the
You can go ahead and pause it. Yeah, I think
Does that bother you?
So one of the things, when you're interacting with somebody with mental illness is that their presentation is not kind of smooth and typical of somebody who is not struggling with mental illness. So he's blinking a lot. Even though medications can be really helpful, a lot of times, especially when we're having somebody who's been using street drugs, the medications now become less effective because it has changed how the brain works. And all psychiatric medications are normed on healthy brains, right? And so that's how we determine their effectiveness, if they work. And then we have that first study, and they're actually tested on people who don't actually have mental illness because they're looking at the side effects. And then they tested on people who actually do have mental illness, but they're typically going to be people who have organic mental illness, and that mental illness has not been exacerbated through substance use. And so psychiatric meds, although very important for people with serious and persistent mental illness, they're only going to be masking some of the symptoms of mental illness. And so he's probably still hearing like whispers and murmurs. So he's really trying to focus on the person talking to him, which is probably why he's blinking. And you can see kind of the pauses in what he's saying. And again, remember, assault is another big thing that our folks will come in who have serious and persistent mental illness. And so those are kind of just some of the things we look for. This guy is stable. I bet he's been probably coming in and out of a system for so long that unfortunately has helped him to be able to recognize. So there's cues. And so even though his brain falls on fire at that point, he's recognizing the cues of being in jail. And so he asks for his medications, or people know, and he'll willingly take the medications. When I build rapport with somebody, I can help to start to get them back on their meds if they've come into jail often enough, and I have familiarity with them. And so that helps me to try to get somebody stable. If I don't have any rapport with them, then they're like, fuck off, excuse my language, but they just don't want to have anything to do with me. I'm the devil. They don't want to take meds. There's nothing wrong with them. They're not mentally ill. And they're saying this in a completely disorganized state. So this guy would be a person who is medicated and stabilized. But one could argue he probably still wouldn't function very well in the community, right? So he would probably have a hard time getting his needs met. And I want to make sure and be respectful of people's time. I feel like there's probably a few more slides in here, but I don't know that we need to necessarily visit all of them. I know we've only got about 6 more minutes, so I want to offer an opportunity for people to ask questions, share thoughts.
Yeah, I'll stop sharing the screen.
Oh, I was going to say I could kick it off. I think you, at the beginning of the presentation, you mentioned that you kind of fell into correctional psychology. Can you talk a little bit about how that happened and what advice you would have for someone who might want to actually like pursue this area and what avenues they should follow.
Sure. Well, answer the second part of that first. If you're interested in it, going to school and doing a practicum or an internship in corrections will give you good exposure. And it helps protect you in a way, because my students, they're not going to be there 40 hours a week. They're going to be like there 2 days a week. And they're going to be, I create the umbrella of protection and guidance, right? So rather than them maybe doing something they shouldn't without anybody helping them, and then they suffer consequences for that, I'm there to kind of help navigate that. As far as how I got into it, I was looking for a job. I had just moved back from California back to Colorado. Colorado is my home state. And I was looking for employment. I had applied at DOC, but interestingly enough, because I have a substance abuse history of my own, they did not hire me. The great irony of it. But so I also had applied, I was really looking for profiles. Like I have substance abuse that I do treatment for, and I have trauma. And so, when they put out their ad, they were looking for somebody who could provide therapy to do like clinical work with people who have trauma and substance abuse. So we ended up kind of like serendipitously finding one another, one could say. And I've kind of been there for a really long time. And they needed somebody who could hang in there. Working in that environment can be challenging. I was not very much welcomed when I first started. A lot of hazing. Female deputies can be hard. They can be really mean. Now we're great. 15 years later, we're awesome. But when I first started there, they saw me as being on their territory. They were going to let me know it. They were going to let me know that I was not better than them, which I did not think I was. But typically that had been their experience with medical professionals, that, that they were somehow their servants. So I had to really think hard if I wanted to stay there after that first year. But, at the end of it, I'm glad I did.
Thank you.
Anybody else have any other questions?
We have a hand up from Donna.
Okay, Donna.
Hi, thank you for taking my question. What I'm wondering is, considering the profile of the people that are incarcerated that have mental illness, it seems like quite high on the spectrum. And I know that from what you were saying earlier, it costs less to have them in prison than it does to have them in a mental health facility. But based on the whole ethical thing, I'm just wondering if there is a conversation happening to separate those people that are truly mentally ill in a different part of a prison so that they can, justify the money, so to speak, and have all of those that separated from the regular prison population. If there is a discussion for that, if there is is there any advocacy happening with that? It just seems like such an offense to have someone who is clearly mentally ill in prison with the general prison population, and the trauma and how you're going to almost like make their condition almost worse because of the circumstances that they're living in prison, to be in a constant state of fear and worry, and it's going to exacerbate their symptoms already.
Absolutely. I can tell you in our facility we do, right? So they get a mental health screening as soon as they come in to our facility. I believe most prisons probably do as well, because of the risk that happens, that putting people with serious and persistent mental illness in a prison population creates a certain amount of risk, not just for the offender, but for the facility and the officers working there. And so I know that they do have certain specialized pods, like we do at the Denver County Jail, with a specialized pod for offenders with SPMI, regardless of their crime. So I have people who have committed murder and with people who trespassed one too many times. But we all kind of get along harmoniously because they have mental illness, and that's usually the reason their crime happened to begin with. And so once you stabilize them, they're like, nice people, gentle people, but it does require a lot of effort. I do know that as far as like hospitals coming back online, that's definitely a discussion our state is having. And it comes down to money, and it comes down to, neighborhoods. Like, there's places that we've tried to set up rehab facilities, things like that. And, people don't want hospitals in their neighborhood, near their community, things like that. We are such a fear-based society at times. So we think of like the worst outcomes and believe that's the only outcome that could be possible. And so I know that unfortunately over the years, we've seen our hospitals shut down more. Now with the surplus of people in competency, we're seeing some pockets of hospitals reopen, but the staff's not there anymore. And that's a challenge too. We're about 1 minute over. And I think this was only supposed to go till 7, right, Chris?
Yes. 7
Generally,
or-
yeah.
Yeah, 7 is the time or whenever you want to stop.
Well, I'm going to go ahead and put my email in the chat for people if they have other questions. That's my personal one. Feel free to email me questions if you're curious, or, you're looking at positions or whatever. I'm happy to answer what I can. And I, just want to thank everybody for their time.
Thank you for your time. This was a great presentation, very informative.
Yes, thank you very much.
Criminology Chats is brought to you by the Chicago School. For more information about the institution, please visit www.thechicagoschool.edu. I would like to extend my gratitude to the students who participated in this episode. This podcast is produced and edited by A.M. Peters with additional post services provided by Audio Photo Synthesis. I'd like to give a special shout out to her because if it wasn't for her, this episode and all episodes would not be possible. So thank you so much, Amy. I'm J.R. Rainbolt, your host, and I eagerly anticipate you listening to our next episode. Be safe out there.
The views and perspectives shared in these recordings are intended solely for informational purposes and do not reflect the official stance or policies of the speakers or the Chicago School. Any commercial products and manufacturers mentioned are included for informational reasons only and do not imply endorsement or approval by the speakers or the Chicago School.